Hey guys, I'm back. And if you're joining me for this first time, my name is Dr. Branin. I'm a naturopathic doctor in New York City. And remember, if you are wanting to learn more about women's health, don't forget to subscribe to my YouTube channel. And if you enjoyed watching this video, don't forget to like it, and also feel free to put a comment in the chat. I'm happy to answer any of your questions, something that didn't make sense. I'm happy to answer it. Well, we're continuing our discussion on herpes. And I know that's not something that people want to talk about. They don't want people to know about. I have had patients over the years that have actually kept it a secret from people that they have been married to for many years, because it is something that can be very embarrassing. It's also just very painful. So we're continuing our discussion on herpes. And today we're focusing mostly on stress. And so as I mentioned in the previous video, that stress plays such a significant role when it comes to herpes. In fact, I've actually seen during the pandemic, a lot of my patients who had not experienced a herpes outbreak for many, many years are now on this vicious cycle because we are in the most stressed out, anxious, worried times of forever, I'd say, or at least for most of us that were born, I guess, after 1960. Very stressful times. And so one that, again, if you already watched my video, but I'm just gonna do a recap, that stress, specifically prolonged periods of stress, is gonna, it's gonna increase inflammation. It's also, this is really fascinating what science has discovered, but it actually causes the immune system to release a particular cytokine. So these are actually things that help us during infections, but they can also not be so useful when they're just excreted for no reason. The cytokine is interleukin 1 beta. You don't really need to remember that name. All you really need to know is that this cytokine, first of all, is present in all our epithelial cells. So these are epithelial cells are things that like line different parts of our body, our skin, our mucous membranes, and herpes loves our mucous membranes, and that's where it comes from, whether it's vaginally or orally. And so basically, during the time of stress, that this cytokine is released, and then it actually activates HSV, also known as herpes simplex virus. And remember that we have herpes for the rest of our life. And what we really want to do, and what we really need to focus on, is keeping it dormant as much as possible. And again, stress is it's probably, I'd say, the #1 trigger of herpes reactivation. One, because of that cytokine, but then also, again, its effect on immune function, its effect on our sleep. Even when we think about, like, when we're stressed out, we just don't necessarily make the best dietary decisions. We eat a lot of sugar, we drink a lot of caffeine, we drink a lot of alcohol. All of these things are just not ideal when it comes to keeping herpes at bay. So how does one manage stress? Now, this video, I'm not going to talk all about adaptogens. I love adaptogens. What are adaptogens? These are herbs that are specific for adrenal health. And yes, it is very true that during times of stress, we overtax our adrenal glands. And there's different phases of how stress affects our adrenal glands. I would say in this discussion, and specifically when it comes to herpes outbreaks, that is not so significant. What's more significant is reducing the amount of stress. Now, yes, there's like this, I think it's like a Buddhist proverb, and if you're watching this and you're like, no, that's not true, about, like, if the world is covered in thorns, you have two options. You can either cover the world in leather, or you can wear leather shoes. Or I guess, like, if you're vegan, you can cover the world in rubber or wear rubber shoes. And basically the idea is that, there's gonna always be stressful things that are going to be coming in our life, or what we identify as a stressful thing. And that could be anywhere from, getting that email from your boss to hitting a car to getting divorced. It's all kinds of things, but it's all about our perception. So yes, inherently you could argue, depending on who you talk to, some things are inherently stressful and some things aren't, but it's much more about how we react to these stressors. And so the first thing definitely is different types of mindfulness. And what I feel when it comes to mindfulness practice, yes, there's the mindfulness practices that we do in the moment when stress and anxiety arise, but then even more so is the mindfulness practices that we do to prepare ourselves, because guess what? Stuff is going to happen all the time. I'll just have to tell you that even today, this morning, I got a call from my boyfriend's mother that the sink is backed up. They're stressors. That's like small. Nobody's going to die over that, but just telling you. So we need to prepare. How do we prepare? So there's so many different things that we could do. If you're someone specifically newer to more mindfulness practices, one of actually my favorite things to just start doing is getting into the habit of monotasking. What does that mean? But actually doing something deliberately one at a time. Many of us, specifically, again, because I work in women's health and I don't want to be sexist, but a lot of us really try to do as much multitasking. We're emailing with a friend while we're talking to someone else while we're getting lunch. And the more that we can actually just focus our mind on one task at a time and getting used to that practice. The other thing that I really like and that I've been telling more and more of my patients about is what I call structured worry time. Because again, we're going to be worrying all the time. I'm just as guilty as anyone else watching this video. But when we actually set aside a predictable time every day to either, ideally I feel, putting it down to paper, even if it looks like chicken scratch, our worries, our concerns. I'm a planner, so I'm like always planning, but setting aside that predictable time. What that does is a couple things. One, it allows us to get it out rather than manifesting here. But what's even stronger is that the worry and anxiety and the stress, if we constantly practice this, when we're actually doing something else that has nothing to do with the trip that we're planning or whatever it is, we can remind ourselves that we actually have a time devoted to that. And if we continuously give ourselves that time and remind ourselves over time, these intrusive, anxious, worry thoughts, they're gonna start decreasing. Will they completely be eliminated? I don't think so, but overall, they're not gonna be driving us crazy. Specifically, this is great practice. If you're someone who has a tendency of mulling things over in bed or waking up thinking about things and then can't fall back to sleep, whether it's, again, things that you have to do or something that you've been stressing about. So I call these like kind of level 1 practices. And then kind of like another level would be doing any kind of a breath practice. My favorite breath practice is what I call either a triangle breath or a pyramid breath. And it's just something really good to practice. And basically what it does is it helps to elongate the exhalation. Why you want to elongate the exhalation is that it helps to bring you into the parasympathetic mode, which is our rest and digest, versus the sympathetic nervous system, which is our fight and flight. I'm not going to get too much into that breath, but if you want to learn that breath, I actually do have a video on that breath practice. Actually, I have a couple different breath practices on my YouTube channel. That's why, again, you want to subscribe. I also have a specific meditation practice that I also really find can be helpful with dealing with these difficult situations. If you're also not super convinced about this whole parasympathetic, sympathetic thing, I really encourage you to watch my, my video with one of my past professors, Brad Lichtenstein, and we talk all about, wouldn't it be amazing just like to live most of the time in the parasympathetic, and that actually could be a possibility. Then kind of going to other, so I definitely suggest, like as I was mentioning before, meditation, yoga, of course, exercise is also great, acupuncture, or any kind of body work. I feel like everyone, that should be part of everyone's self-care, is weekly body work, whether again it's acupuncture or massage, Reiki, craniosacral. I'm a big fan. I do Alexander technique that not just helps me with my posture, but actually really helps with my own, again, stress and anxiety. And then another thing, again, that really helps across the board is most of us probably need some form of talk therapy or counseling, and that can be either working one-on-one with a practitioner, but now, I mean, there's so many different types. I mean, there's group therapy, and then also if you're not a big talker, there's art therapy, there's music therapy, there's all different types of therapy. We live in such an amazing world. So that's when it comes to the stress piece. Talking about a little bit about some of the supplements that I recommend for herpes, and like there's kind of like two aspects of that. There's like the prevention, and again, we're not preventing that you get herpes. What we're really trying to prevent is outbreaks. And then also when you do have an actual outbreak. So if we're thinking about like, and most of the nutrients on both ends kind of work both, but when you're actually in active outbreak, you're definitely gonna wanna do higher dosages. So, you know, the top nutrients I definitely would say are zinc and vitamin C, one for immune support, but also really helping with viral replication, meaning reducing viral replication. So, you know, using lower dosages when you're not in an active infection. So in most really good multivitamins should be giving you enough. Usually my favorite vitamin, or my favorite multi right now, if you watch, I do have a whole video on like, you know, what I actually take, but my favorite right now is by Pure Encapsulations. No brand alliances, but I really like this product. They're Pure Genomics. I also like their Pure Response as well, specifically if I find that the patient I'm working with has a long history of a lot of chronic stress, because that has some additional nutrients that are really important. Specifically, again, I know that I said, no adaptogens, but I do find that that product is really good. Lysine, which if you're watching this, you probably might be very familiar. Lysine, L-lysine, is an amino acid, and the way that it works is it counteracts another amino acid, L-arginine. And so the way to do it is either by increasing dosage of L-lysine. So typically, usually just for prevention of reoccurrence, I usually will suggest about 1,000 milligrams, again, depending on the patient. And then increasing that to about anywhere from 3,000, sometimes even more, again, depending on the patient, during an outbreak, while reducing arginine-rich foods. And if you are somebody who's chronically getting outbreaks, definitely want to look at your stress, but you might want to look also at your diet, and perhaps like that is also something that is encouraging the outbreaks. The other nutrients and herbs that I really like, as I mentioned in my previous video, monolaurin, which is derived from coconut. Humaric acid is also another one, specifically when I'm working with a patient who, you know, is really getting a lot of outbreaks. I also like propolis. I love lemon balm, also known as Melissa officinalis, licorice. Basically, again, like if you're in an outbreak, it's all about, you know, really increasing immune function so that you're not suffering too long. And then also, again, like working towards prevention. So what does it even mean to work with a naturopath, specifically when it comes to outbreaks, when we're talking about herpes outbreaks? So yes, I mentioned like stress management and some of the supplements, but there's always some other pieces that are always somewhat missing. Because if we think about really what is the heart of naturopathic medicine, it's all about root cause. And so yes, again, there's a lot of supplements out there, and there's a lot of very, pretty standard diet recommendations, but there are always some other factors that need to be taken into consideration. In the previous video, when I talked about triggers, one of the triggers I talked about, for example, was the menstrual cycle. So hormonal balance always has a part to play, for sure. And so that's always something when I'm working with patients that have been experiencing a lot of outbreaks is, what are your hormones like? And my favorite way to look at hormones is the Dutch test. And I usually will have my patients do the Dutch test complete. One, because we get to see how your testosterone and your progesterone and your estrogen are. But I also get to look at your adrenal glands, your neurotransmitters, then also different markers of detoxification and antioxidant status. So these are all really important, not just obviously for genital herpes, but all health conditions that I work with. So I know I gave you a lot of information. Take definitely what you like. If you like this video, don't forget to like it. Awesome, you're always open. Please, I love comments. I love answering your questions. And definitely don't forget to subscribe to my YouTube channel. Well, thank you everyone. Again, my name is Dr. Ivy Branin. I'm a naturopathic doctor in New York City, working exclusively now with patients all over the world, all over states, using telehealth. Look forward to seeing you next time. Have a great day. Bye.